So we'll start in another 2 minutes. Let's give it time till 9 to. Ma'am, very, very little idea kindly guide. Okay, for sure, Sagar, we'll do. And there's so many note takers in the call. Okay, perfect. So anybody first time to this Salaah webinar? I think let's start. So how we'll keep it? First, I'll introduce myself. I am Astha. I'm co-founder of Salaah Shots. And Salaah Shot is creating a community platform for doctors so that one doctor can help another doctor. It's more about how the one who have been in the shoes guide the other one with the experience and learnings they have. So with that intent, we thought of why not bring the seniors who have already cleared CMS and they have quite a good understanding that what it takes to be an officer there, have this session for all of you. Because the long mentorship or the CMS interview prep program we have started, it's a very close program so that everybody could get enough attention. So it's an extensive close program, but for the one who can't afford it or the second who couldn't get a spot there, they can be part of these type of session and get the learnings. So with that intent, I have called Rishi, Sir, Nishant, and Sagar. They'll help you out, and we have Ashmita. So they will help you out with all the questions and why the CMS interview prep is important and how we have to do it. What all we have to keep in mind. So without me speaking a lot about it, I'll pass this to Nishant and Sagar, and they can guide you with that how you have to be ready for the interview. So over to you, Nishant. Hi.
Thank you, CEO. Uh, Good evening, everyone. Myself, Dr. Nishant Dhiman. I am currently serving in Indian Railway Health Services cadre. I am from batch 2019. Sagar is my batchmate. And as the CEO has already told that we have started this platform to basically help out the doctors who are not aware of these various proceedings that we have. So when we were preparing for these type of interviews or the examinations, literally we were not aware of it. And even very few people have the right idea, the right way to guide us. So definitely these type of learnings that we are here in this platform, our main aim is to guide you properly and to ensure that you have a uh, selected seat in your favor. So the this basically this UPSC personality interview, what actually it is. So that is more important because most of our doctors, most of us are the doctors who have undergone various type of vivas, but we are not aware basically about the thing that is the personality. So the most important thing, as the name of this test suggests, that is it's a personality interview. Many of you from your preparation of your NEET undergraduate, NEET post-graduation, INI, you are very well be in a position to clear the written examination. But the huge difference is made by this interview. So why this interview is important? Because it will not test you how good you are in your core medical knowledge. It will test the way how good personality you have, whether you have these type of leadership qualities that they wanted to see. So the ultimate aim is they are not sitting there to take one doctors. Doctors can easily be hired, but they are sitting there to hire a one officer. That is more important. So I think Dr. Sagar is with us also. We are going to take all these things step by step. Dr. Sagar, you want to add something or we should proceed?
I think there's a power cut at Sagar's end. So Nishant, you can
Okay,
cover. He'll join in between. Yeah. I just got a text from him.
okay. No issues. So we will be taking all those questions later on, and you can just pin all the questions. I'm also able to see the chat box. How the things will occur, we will take step by step. And I would request the CEO to play the slides that we have for our candidates. Okay. So before proceeding, this UPSC CMS examination, you all must be aware that it has two parts. First one is the written examination, which you all must have qualified, or you may appear the next year for the your this entrance for preparing this interview. So first step is always the part that is the written examination. Once you clear the written examination, the most important part is the personality interview. So why this personality interview is important? Why the our platform, what we are doing is we are teaching the doctors how to become an officers, how to behave like an officers. So while appearing for this type of interviews, they don't get afraid, and they ensure a good marks. So it is very important to know that this UPSC CMS examination itself is now a trending hot topic. Those are the days which are already gone, when the people, they don't pay attention to this UPSC CMS, and they usually focus on the post graduation. But now the UPSC CMS has become a cornerstone. And why it is becoming a cornerstone? The most important thing is the saturation that is coming among the doctors in the different states. So this UPSC CMS is in giving us a very good handsome package of the salary, along with all the luxuries as a class 1 gazetted officers that you will get, especially in different cadres. You will get all the leaves facilities, and a more important thing is it a work balance life. So many of the doctors who are not just the pass out MBBS, many of the doctors who are the specialists, who are already working in the different areas, like in the state services, who are working in the private firms, they are all coming and appearing for this personality interview. So preparation of this personality interview, even if you are an MBBS, you have to stand out from those specialists. Or if you are a specialist, then you have to stand out from an MBBS who have a leadership qualities. So the core medical knowledge, whether you are an MBBS, whether you are a specialist or you are a super specialist, it will not be just. The main thing that will be just is your the personality. And this is what we make it happen. So in the Salaah Short platform, what we actually teach, we teach how to develop the personality. And that is very much important thing. So most of the mentees that come to us, they, some of them have some idea, but most of them, they are not aware of it. So when we are thinking of this personality, so this personality preparation, it makes a difference. How it's going to make a difference? It will separate you from the normal person who have secured a good marks in the written, but he has not secured a so good marks in the interview examination. So the core component that we teach in this program, that from where your personality starts. So everyone, many of the candidates who have qualified for the interview, they have start filling their DAF form. So in most of my sessions, I start that the DAF is the first basic step of your personality. So the DAF stands for detailed application form. So what actually DAF checks you? The DAF checks how much aware are you about yourself. If you are well good aware about yourself, then you are able to fill that DAF form easily. And that DAF form will become the basis of your interview when you will enter the UPSC room. So this DAF is very much important. So your journey for this personality interview prepares from the filling of your DAF. Now, when you have a good DAF, so that DAF form will be the basis of your interview. The interviewer will see your DAF and will ask the questions from it. If you have a good knowledge regarding your DAF that you have filled, you can secure a very good marks. If you have not good knowledge about your DAF and you have filled it just leisurely without any concentration, it's like, okay, let's fill the DAF, whatever happens, we will see. Then again, it will make a difference, and definitely you will lose the seat. So filling a DAF form is the most important prime thing while preparing for the interview. So CEO, anything you want to add on this DAF part?
Yeah, so Abhi, the time is already over for the DAF, but you all have your DAF in hand. And now you all have to focus a lot and lot on that where are you coming from. So there are a couple of very important components from DAF which you should go and mastery at any cost. That the place you are coming from, the background you are coming from, what your parents does, what your hobby is, and how that hobby is combining or making you as a good doctor. So there are a couple of very important components which they can pick and impose you on from your DAF, which is very important. Nishant, do you want to cover one or two sample questions from the DAF?
Yeah, yeah,
Yeah.
definitely. Yeah. So most of the doctors they fumble up when we ask what is the meaning of their name and how they justify with their personality. So it simply tells that whether you have analyzed yourself or not. So that is just a basic question. So whenever you are entering that UPSC room, that DAF is will be already with the interviewers, and they will be seeing what you have filled from your names. So definitely the names that you shouldn't be fumble about. And most of these the are what we say the candidates they are living outside their rural areas in the urban areas, and when we ask from where they belong, what is the state, their hometown, and they even don't remember which place actually they belong. So it is these are very basic things that you what is actually your origin, how the people are living there, what you have learned during your childhood times. So these are the things which comes with the practice, and if you don't practice with this self introspection and self realization, then this will create a negative point in their favors. So these are
Yeah,
2 to 3 things, basic things that everyone should focus on it.
right. And at the same time, you shouldn't start over explaining everything, because this is what I have observed with the most of the people who are part of the mentorship program and coming for the interviews. They are trying to justify their answers too much, and that makes the answer very boring. So you have to understand and go with this mindset that you only have 15 to 30 minutes with them, and you only have to say good things about you, good things in a right, appropriate manner, that it shouldn't sound that you are there just boosting yourself. So you don't have to say too much negative, you don't have to say anything which is very boosty, but at the same time, with right intent, you have to put the right message about you. And rather than just roaming around with your words here and there. And one very important thing which I can think of is, if somebody have a very sudden score drop in their DAF, that somebody is very good performer in 10th and 12th and college, suddenly there's a score drop, be very like aware of that, why there is a drop, so that it shouldn't shows that initially you are a good student and now you have like changed, something has changed. And at least a bit good awareness about the place you belong to, the city, and college you are coming from. It shouldn't sound like you are just a doctor who mug up the books, who have no idea about how what is happening in the outside world. So you should be the person who shouldn't master the history, but at least have some information about what our country is and what each and state of has to offer. Rishi sir,
Yeah.
anything from your end on that? Sir, you are on mute, and the personality is
Uh,
concurrent. Yes.
Good evening, everyone. Good evening, all my friends, Astha, Nishant, and Sagar. Uh, I would like to say that people who have qualified for the interview, congratulations, and people who are preparing, all the best for them. My 3 4 points are there. The moment you enter the UPSC interview room, you are being judged, and from then on, you have to carry yourself as if you are going to be appointed. So the doctor, the IAS who will be sitting, they will be asking you questions. That will be theory apart. Apart from that, whatever you have filled in your detailed application form, like your hobbies, like what do you think about politics, whatever you have written will be asked. So they don't know about your background. They know nothing, not even your scores. What they know is by your what you have written in that DAP form. So you can influence your interview as you want and be honest in that. See, if they ask you that what are the hobbies you like, what are the sports you like to play, then mention the sports which you are thorough about. Not like you have to tell everything, swimming, basketball, football. If you write like that, then you will be in a very tricky situation. So if you like to play badminton and you are thorough with the rules, write it. So that if somebody asks you about the badminton court rules, you will be able to tell. Similarly, you will be asked about your hobbies in the leisure time, whatever, if you like some music instrument, and then you will be judged on the basis that if you are being appointed, if they select you, then how will you be an asset to the organization? So for a railway organization, how will you will be able to manage the situation in a disaster, in a situation where there is a train accident, in a situation where natural calamity has happened and a lot of patients are coming to your hospital or your health unit? How will you manage situations? So uh, as a interviewee, uh, you will be judged that apart from your theoretical knowledge, you know how to manage people, because in a health unit, in a hospital, you are going to be the in charge. And once you are in charge, you have 200 or 300 employees under you. So there will be infighting, there will be absenteeism, there will be people who will be not coming. So as a in charge, as a officer, when you go up the higher ladder, your leadership counts, and that's how they are going to judge you. So not only the theoretical part is important, your leadership qualities, your ability to lead the people and take them together is important. And as a asset, so if you are posted in a health unit, how will you be able to manage 1500 to 1000 employees under you? Then you switch to a divisional hospital where you have to manage around 25,000 people. And then in a central hospital, in a zonal hospital, there will be lakhs. So that is gradual learning, but they can judge you from your appearance, from your the way you answer. They will be able to better judge you. So this is the time to prepare. This is the time to just know what you are being uh, subjected to, and that is where your preparation comes. So if someone who has just qualified and goes into the interview without any preparation, he may fumble, but when you are well prepared, you are confident, you excel, and that is what we are doing. That's it. So back to
Very
Asta.
well said, Rishi sir. Matlab, you have covered all the important points. Sagar, do you want to add?
Yeah, hello everyone, and
Sagar is
good,
playing
good,
live on a thing.
yeah, good evening to Dr. Rishi sir and Dr. Nishant and everyone present here. So first thing which I want to quote ki just you can watch on the screen that ki your interview prep starts like Nishant said ki it starts when you fill the dash and start when you just planning to enter into the UPSC gate. What matters the most is your awareness and presence of mind, because I'm going to quote some examples for you that these things going to ask from you. And what my experience was, what was the story of my interview, I'm going to tell you in this webinar. So firstly, I'm starting you the few questions which has been asked in last year UPSC interview from our few students, those who have taken the mentorship from us last year. So what I'm going to share you is key when you start, when you're entering the UPSC hall, you need to take care of everything. Whatever things you are watching there, like they will ask you to sit in the room, and you are sitting in the room, and you have been assigning a particular group where 4 or 5 more people are sitting with you. You need to have a good interaction with that people. You need to know at least what's their name and from which place they belong to, because maybe possible while entering into the room, the first question will be how many people were there, and the whom you have talked to, what that person is belong to which state. So these are the basic questions they're going to ask you, because they also don't know from which state that person will be, but they are just checking your how much confidence you are, and how you are answering of these points. Like last year they have asked while entering into the UPSC office, where was the sun? This was the very basic questions. They just want to check your presence of mind. Ki where was the sun? They also don't know ki where was the sun. You only entered. So you just have to answer quickly. There's nothing like that. You start thinking about ki, where was the sun? Where was the sun? Because you also know ki they also didn't know ki there was the sun. The second question what they asked last year, ki, uh, where you are sitting with the other your colleagues, and when you are entering into our room, how much steps you have taken. They also don't know ki how much steps you have taken, but they are checking your presence of mind, ki how much you are aware of these things. You can tell ki 300 steps. They also don't know, and you also don't know. You just have to utter something which is basically show you ki how much confident you are, how much aware you are. Like many of you have cleared the NEET PG also. The same happens with me when I entered the room. The first question they asked me ki have you cleared the NEET PG or are you preparing for the NEET PG exam? So my NEET PG was just after the 1 month when I went for the interview. So I told you, no, sir, I was preparing for the NEET PG exam. So they told me, okay, you are preparing for the NEET PG exam, you will do the post-graduation and then you will serve in the cities. So what about the rural areas? So tell me what will happen to the rural areas. So I told you, sir, there should be some change in the policy of the government so that everyone get this opportunity and infrastructure should be good infrastructure should be there. So they told me, Kare, chalo, okay, you will be the health minister for this whole day. You want to change something, put your policies in front of me. So this is all about your presence of mind because I also don't know what they're going to ask you. You just know you just have to utter something with confidence that they're going to believe this person, if something sudden situation will come up to that person, he's going to behave quietly with the patience and with good answers. So these things are the basic things you need to take care while entered into the UPSC hall. And all of you have cleared the written exam. All of you know the basic theory things. You just have to focus on the basic internship postings which you have went through in the basic third and final year subjects. And they're going to ask you only internship posting things. They're not going to enter you there. And in the next, Dr. Nishan will tell you how to lead the interview. This is a very important part which which all you should know how to lead the interview, because when you enter into the hall, they're going to ask you what you have seen in your surgery posting. From this point, you need to know how you're going to tell what you have done during your postings, because if you will say I have done the surgery in surgery posting, from their point they're going to ask you the every steps of the surgery which you're going to utter. If you will say just I have know how to put the IV cannula, from that point they're going to ask you tell me the steps of IV cannula. So your interview will be decided by you only. So you have to learn how to lead the interview. So Dr. Nishant will going to tell you in next 5 or 10 minutes that how to lead the interview. Then we'll talk some more points.
Okay.
Adding one point to Sagar's point till now, that in interview, your confidence and composure both is very important. If you will take Dr. Nishant example, he was there dancing during his interview because they made him dance. And the only thing which stand out, because that year he was one of the top scorer in the interview. What stand out that even in that difficult situation, when people put you under pressure, you are there and performing what is allowed, like what is like expecting out of you without losing your composure and confidence. So you all have to be very prepared with what comes on your plate, and whatever is coming, you don't have to get there being in a panicky state. You have to be in a state that you have to manage. Over to you, Nishant.
Okay. Thank you, Astha, and thank you, Dr. Sagar, and thank you, Dr. Rishi. So before going further, I just want to recapitulate the things that we have discussed so far. DAF is very important thing. As the Astha have highlighted, as the Rishi sir have highlighted, your personality is very important thing. As the Sagar have highlighted, that how you will lead the Vivas. Okay, so your awareness. So the one is DAF personality. I always tell the candidates that you should behave like an officer from the moment that you are preparing for this interview. You should feel that you are an officer. Once you start feeling that you're like an officer, then itself it comes from your expression, from your body language, that you're an officer. The third important thing the Sagar, as I have highlighted from his questions that he's picked out, that we teach our candidates how you have to answer these questions, is the awareness. So from the moment that you have filled the tab till you leave the UPSC room, till that period, you should have a complete awareness of your surroundings. That I teach to each and every candidate, and even we practice these questions. We try to take how these questions are being put up, and from those questions, how the interview is going to ask and assess your personality. So these three things have been covered by them. And the most important thing that I'm going to cover now is how to lead an interview. So it becomes a core of our this program, this personality test, that how to lead an interview. So there are many people, they ask these simple questions, that how many answers we should give. One. Second, what should be the duration of the interview? Then we can assess that we are already selected or not. So these two things, they have no relationship with your selection. Okay, even if you give no to 10 questions and you give a one correct answer to the 11th question, you will be selected. Even if you are interviewed for 15 minutes, you will be selected. And even if you are interviewed for 45 to 50 minutes, then also there is a chance you will not be selected. So all these things matter. Why it matters? That this is the thing that we teach, that how to lead an interview. So as the Sagar has already given the examples, I will start mine. So I have written in my DEF, I have participated in physiological quiz competition. So the IAS officer, he pointed out, okay, Dr. Nishant, you have participated in this quiz competition. Just tell me about ABCD quiz. I even don't remember the name. So I said, sorry, sir, I'm not aware of it. Then he demotivated me at the first question. You have already, so Nishant, you have already mentioned about the quiz competition and you are not aware of these basic things. I said, sorry, sir, I'm not aware of it, but definitely I will look into it. So that was the first question. I was flat. Second question, he said, you have mentioned about the dance. So I just written the dance. That's why we teach each and everyone, whatever you are writing, it should to be the point. So he said, what type of dance you know? I said the cultural dance. So then again, he made me flat. Okay, so you have just mentioned the dance. What about other dance forms? So I said, sir, I just performed the culture dance. Then, okay, in a light tone, then he said, okay, with my confidence, he saw something. He said, okay, will you perform a dance for me? Then at the moment he gave me this question, I got an opportunity to pick it up. I said, definitely, sir, I will do it with a smile. The next thing he said, okay, I will assess in the end whether you are worth of it or not. So this much only that IAS officer judged from my personality and he shifted my interview to the medicine part. So as the Sagar is telling, all these people who are sitting there, the doctors, they will definitely ask you the questions not from your textbooks, but from the things that you have done. He said, what postings you have done during your internship. So I was intern. If you are a specialist, then definitely they will ask what all the cases that you are seeing. So the moment he said what postings you have done. So for leading and Viva, now he has thrown that question to me. Now whatever I am going to utter from my mouth, it will be a next question from them. So I said from an emergency posting, I have attended the unconscious patients. The next question he said, okay, so what all different unconscious patients you can expect them, how you will proceed to those patients. Now I was aware. So I have that approach in my mind. So like that, my medicine viva went. Similarly, from my gynec viva, she said, okay, so you had an internship? I said, yes. Okay, so can you tell me about labor room? So my viva shifted from labor room to the episiotomy steps that I have done. So I took that viva. Similarly, from the orthopedician, I never thought of that. Nobody told me that orthopedician will be there. He said, okay, so you must have attended the ortho internship. I said, yes. Okay, so what all have you done? So I just remembered the thing that I have done my internship, all the reductions. Okay, then he explained me how you do it. So this is the way how you lead your vivas. So we have seen so many candidates and even we have prepared during our sessions that when we are asking these open questions, they are not even to tell a basic things. Once an open question is being asked from you, then the ball is in your side. You have to take it to the next level. You cannot say, okay, I have done the suturing. When we ask from which material you have done the suturing, okay, let's imagine you are in a dressing room and you are doing a suturing, how many people you will be requiring. The people are not aware of it. That is very sad thing. They are not even aware of what type of suture material they are using. Very simple things as the Sagar is telling. From him, I think, if I'm not wrong, the steps of IV cannulation have been asked. So people are not even aware that they have to sterilize the thing before getting for the IV cannulation. Okay. So very basic things are being asked. So that is the crux. That is how to lead your viva. Very much important. And this is a part of your personality. Not only for a core subjects, but also for the things that, as the Rishi sir pointed out, that you will be asked by the officer like leadership roles. You have to organize a basic camp. When I'm asking some people, you have to organize a basic camp. They just say, I will arrange the doctors, I will do in this. Very few candidates, they come to know whenever you are arranging such a big program, you have to make the people aware that you are going to organize the camp. You have to know what basic things you have. So you should have a thinking like that. So that's why this personality assess the overall thing. Okay. Dr. Sagar, you would like to add on this?
Yeah, like Nishant has told, I'll share my few questions with you. Like when the interview has started for me, the first IS officer asked regarding the NEET PG and all, which I had already told you. Then my viva shifted to the surgery professor. and he just asked me, ki, Sagar, what all surgeries you have done during internship? He's giving you such a thing that definitely you're gonna tell, ki, sir, I have done appendectomy, I have done a version of sac for hydrocele. But what I choose is, I told, sir, I haven't done any surgery. It's not like that he's gonna judge me ki, oh, Sagar, you have attended surgery posting and you haven't done any surgery. It's not like that. I told ki, sir, I haven't done any surgeries. I just learned how to put a Foley's catheter and how to put a IV cannula. And the questions are now from the Foley's catheter and from the IV cannula, which I already know. So it's all about how you wanna lead your interview. And the same, the question shifted to the gynae part. The gynae ma'am just asked me, Sagar, tell me which all cases you have seen in your OT. I just told few questions, few cases which I know I can answer all those questions. And the same again, the question goes to the IS officer, and he again started asking me. And one thing he asked me at the end, which I'm gonna quote here, is Sagar, after this interview, how you are feeling, and can you just give us few advices if we can improve our this board members to ask very good questions from the other candidates. He is just asking my advice, but they are more smarter than me. So I just told you, sir, how can I give advice to you? You are just taking my interview. But if some over smart person will go and definitely start giving advices to them. So they are judging things. If some seniors will be coming to you and they are asking some questions, and so your advice, it's just not like you need to prove them wrong because you know better than them. It doesn't like that. If you are into the government service, you know how you have to behave with the seniors. If they are doing something wrong, so you can't speak on their mouth, you are doing these such things wrong, because they have their own ego and everything in the government service. If you go to any government service, so these are the things which you need to learn how to answer, because all the posting things and all everything, you're definitely gonna answer something. And like Nishant told, it not depend on the duration of time. And I have shared this story with so many people, and now I'm again sharing this. Last year we have one guy whose interview just went for 15 minutes, and in that interview only 3 questions have been asked from him, and all from the opthel. But after the interview, when he called us, he told, sir, my interview didn't well good because it was just for 15 minutes and they didn't ask any questions from me. But after that, when the result came, he got the highest marks. In just 15-minute interview, he just answered 3 opthel questions and he got 75 out of 100. Why? Do you know why? Because the smile on his face, the confidence on his face, the way he entered the room, the way he responded to the committee members gave him the good marks. Because all of you know, and some of you don't know, maximum marks will be with IS officer. That retired IS officer will be sitting there. He'll be observing you. Because during my interview, when all other professors are asking the questions, he just stood up and taking round around me. He was just observing. Am I feeling some nervous or not? If I'm not able to answer, also no. What I used to do, I just started smiling in front of them. Make them believe I am confident, but I'm not able to recall. And I'll go and I'll definitely read these topics. So it's something you need to learn. One more thing, you need to learn how to say no to, because more people will just take this as a viva, and they have just asked, tell me which surgeries you have seen in your surgery posting. So they start answering all the surgery names, and by their own they start telling the surgeries steps also. They are not interested in knowing all these things. They just want to know what all surgeries they want to know. Okay, so just you have to focus on things which they're gonna ask you. Okay, so Nishant, you can want to ask. Rishi sir, if you want to add something like this, officers like quality, what should be with us?
I think Rishi sir is here. He's typing.
Yeah, no worries till he comes. Yeah,
yes, come again.
Yes.
Yeah, sir. Sir, can you just quote some officers like quality that this for the student, what they need to carry with them while going for interview?
Yes, so the first and foremost is you should be smartly dressed. You should be wearing preferably a suit with a tie and black shoes or brown shoes, whatever suits you. Then the second thing is, when you enter the hall, you wish everyone and don't get seated until you have been asked to. Thirdly, don't smile just put up a presentable face and need not be talking something which is foolish. So when you are asked about your name, your background, and whatever you have done before, so try to be honest and as simple as that. Don't smile excessively. It gives a bad impression. Then the more important thing is that if you need to ask for any permission, then you can humbly or honestly ask, sir, I need to take a sip of water. And these are the most important officer-like qualities which you will be judged on.
Yeah, Nishant, if you want to add something.
Yeah, definitely. And the example that you are taking, Dr. Sagar, and it's because we have taught him how to start the preparation, the moment how he has to enter the interview room, how he has to present himself, how he has to sit well, how he should keep his hands, how he should speak, how he should give a pressure on his speech, where he has to give a pressure, how he has to be humble, as the Rishi sir has pointed out, from where the manner he has to greet all the seniors, how he has to lead the Viva, and how he has to end the Viva. So I think all these things that have aligned perfectly for him for that day, probably it has started when he came to us with very, very basic knowledge. He's not aware of it. We never thought of it, he could make it. But all these sessions, he was able to make through it. So that's what the personality is like that.
I would like to add one thing that for female candidates, they should be preferably wearing a sari or something formal.
Yeah.
Yes, definitely. And no extra thing of nail polish
Yes.
or like shiny, glossy sandals and all. Just be very well dressed up. And your eye contact is very important while you are talking. It shows a lot of confidence. Don't sit there and looking here and there. And Nishant always say during his interview session that when you are greeting and talking, you should be looking at that particular person's eyes rather than looking here and there. So if I'm talking to Rishi sir, and if I'm greeting Rishi sir, I should definitely look into his eyes and greeting Rishi sir like, hello sir. So it shows that I'm confident and I'm giving you consideration. And going there, don't start saying that hello or good evening everyone, good evening sir and ma'am. Just look into everybody's eyes and then greet them. It shows that you are giving them right enough consideration and all. So these are basic things which, but they are very important thing on what basis you are getting judged. And like female candidates, no nail polish, no fancy, no glossy rubber bands, hair bands, or nothing. Just be like an officer, very well dressed up. Last year there was a girl. She dressed up so well that she even get compliments saying that we haven't seen any candidate so far who dressed up this well, and she got additional marks for that. So you should be keeping this thing very important, that how you're going there and like how you are speaking, every word coming out of your mouth.
Yeah, one more point I want to add ki lot of people have messaged me regarding ki sir, I have got good marks in the theory. Is it more compulsory to prepare for the interview also? Because if I'll get some marks in the interview, I can clear the exams after adding both the marks. So let me tell you one thing, that this time, if you have all known that ki UPSC has suddenly changed the criteria for those who people have got equal marks, because there was more people are there ki they have got the equal marks, and there is a very less difference between the marks of the different people. So because of this only, that's Nishant has told ki already the competition have increased and there is a very less marks difference at last year we have, also we have seen. So it's very important nowadays to prepare for the personality test very well, and you need to take care of everything which we have discussed right now. So it's not, don't think like that ki while just you got a very good marks in the written test, you're going to clear the UPSC CMS. And if you may be possible, if you get cleared the exam, then the next question comes, you will not get your choice posting, you will not get your choice of cadre. So all these things are also dependent on your personality test, that ki after clearing your CMS exam with very good marks in personality and theory, you will have very good chances of getting your choice posting. Like so many of people have asked me, will I get my home posting or not? So all these things are also dependent on your marks. So think about this, then proceed. Is it necessary or not? Yeah, Nishant, over to you.
Yeah, I think the most of the points have been covered by Astha, Rishi sir, and the Sagar himself. And I always say to the boys that always carry a tissue in their pockets. And so whenever they are going to enter that room, always that tissue will help you not to clean your face, but to clean the back of your shoes. So that is very important thing. So when you're going to say thank you, you're going to stand up from your chair and you're going to proceed to the door. They will see, definitely the right IS person will see how well dressed you have kept your back side of your trouser and your shoe. It should not be dusty and it should be neat, clean and shiny. So even till that to that point will make a difference of you. So there are more points. There are more points. So just telling these points will not help you. So you have to come with us. You have to come with us, or you have to go in front of the mirror and you have to start practicing with all these points. That is more important thing. Until and unless you don't bring these points in your personality, and until and unless there is no one to see and judge whether you have those points or not, then it is a difficult part. So to make a difference, you should start preparing from this moment onwards. Definitely. Over to you.
Yeah, I think let's give them because it's already 9:45. We have 15 minutes. Let's give them some time to ask their questions. And if anybody will have any questions, just unmute yourself or ask, or either just put it in the chat box. So there's one question from Raj Nandini. That sir, in DAF, I have written dance and debate as my hobbies. How to lead it like Q question sample, sir? Debate. This is, if I would have been there, I would have been bombarded you with a very good question that how debate is your hobby and which is the latest debate you have participated in. And that is just enough for me to put you in a state that what was covered there, to just check that you have wrote it for sake of it or do you really know anything about it. So like Raj Nandi, which was the latest debate you have participated in? And which all dance form you are aware of? Ma'am, I'm 10th.
Yeah, Rajan, you can unmute yourself and you can ask question. No? Then it will be clear on the question.
Good evening, ma'am and sir.
Yeah.
Actually, ma'am, in standard 10th, that was the last debate that I have performed. And while filling the DAF, I didn't knew exactly how to fill it, as Astha ma'am knew from my perspective that what I was going through. So I filled it up. Now I'm like, if I have filled it up, I need to get to that point that I'll be able to at least accept the bombarding and answer confidently. So I'm asking like how to take it forward from here or be prepared in a sense.
The first question they're going to ask you on which topic you have done the last debate. You need
Latest
to.
debate. Where are you figuring out debates to participate in?
Yeah.
So if I'll ask, what are you doing right now? I know you're working. So how are you figuring out which source or medium you are figuring out debate is happening? Are you participating in online debate or offline debate? How much, which was the latest topic of debate you have participated in? What was your scores? What was your answer? What have you learned from the debate competition? So there's a lot of questions that can be formed from that.
And the most important thing, they're going to take you as if you're going to argue with them. So they will put you in some situation that you have to argue with them. It's a healthy argument that like they can ask you in some negative point of the doctors. Like right now, if you go into the corporate hospitals, people are telling that doctors are looting and all. So you need to give your argument positively for that. Like nowadays, there is so much of problem for the doctors, like assault and all. So they're gonna ask you a question on this. Check your debate skills. Are you really arguing with very positive things, or you are just putting the things? So through this, they're gonna check your positive and negative personality through this.
Yeah. So start preparing, keeping any topic which is related to healthcare or other one, or which you have thought of putting out there, and start preparing for a summary of debate, how to sum up your point of view in debate, because debates start with you presenting your point and summing up and putting your point of view that consists of both positive, negative, and what you support. So
ma'am.
start doing that, like practice more and more of that, because debate is definitely gonna come.
Okay, ma'am.
Yeah,
And about
Nishant.
dance, ma'am, will I get a chance
Let's
to
not,
dance like Nishant, sir?
let's I'll definitely come to it, Rajnani. Let's pick more question, because
Okay,
there
ma'am.
are.
Okay. Thank you so much, ma'am.
Nishant, you are saying something. First, help
Yeah.
Rajnani, then move further.
Just I want to just want to say that it's a very good opportunity for you. Okay, so the debate things is a very good opportunity. Take it as an opportunity, and whatever Asta have told you, go for it, study for it, and that's it. That's how they're going to ask. They don't going to ask the rules or something like that. The burning issues right now, and definitely Dr. Rishi will agree with me.
Yes, definitely, I'll agree with you. And in my experience, when I was appearing for the interview, then I was asked about. I wrote about at a length about the Android and the Apple. So they asked me about the difference between the open source and the closed source software, and what is the difference between iOS and Android, and what do I think about Microsoft. So it took to another dimension. Apart from the medical thing, my interview was also on this. Secondly, I wrote length about I like to write about read about philosophies and the various religions. So they asked me about the types of Abrahamic religions. So I told them, which was my favorite topic. So then they asked me difference between Sikhism and Hinduism. And this is how you can uh, direct your interview towards where you want, where your stronghold is. That is why I'm trying to tell you that in a DAF, and when they are asked about the question, be very specific so that you are taken to that particular thing. Don't be vague. Like someone asked that my hobby is to watch movies. So you can be asked about the latest national award winners, like Shah Rukh Khan recently got. So, and what was a wholesome entertainment movie this year? Dara Sahab Phalke Award. So, something related to the movies can be asked.
And genre of the movie is also very important. You, which kind of genre you like around that, and then more questions on that genre. There is one question that which is the best cadre to choose if wanted to job in home state? Rishi sir,
Yeah,
best.
Nishant will better answer
Yes.
this.
Nishant,
Nishant
Can
will
you
better answer this.
can you come again?
best cadre to choose if wanted to job in home state.
See,
So see, again you have to find out that in your state, in your particular city, you go and visit the railway hospital. You go and see the CGHS health unit, and you will get to know a feel about it. And there is no harm in reaching someone. There are many people in my railways who have visited railway hospitals before being part of the UPSC, and that is how they were having a inclination towards joining railways. Similarly, with CGHS, people have visited various health units. What is the work schedule and what are the population they are taking care of? So some of my batchmates are working with the CGHS cadre. So you have to yourself find out. And if there is no vacancy, then better choose your second option, which you are likely to get.
And those
Yeah,
coming
Nishant.
from
Yeah, Nishant.
Delhi, and one more thing, those belong to Delhi and Haryana, all those reason. Be prepared with pollution question. Everything around pollution. Because the time you're preparing for interview, this Diwali season and the pollution is on peak in Delhi and Haryana. So why it's happening, what's the root cause, what are the treatment, disease, everything which comes around that, be ready with that. Nishant, best.
I definitely respect the views of Rishi sir here. If you really belong to Delhi and you get a MCDS cadre, or you are from the state, you are means from the neighboring states, then definitely if you're filling MCD or NDMC, you will get that posting in Delhi itself. See, so whenever you're filling this, probably everyone have read the notification of UPSC. It's an all India posting. Okay. So I tell all my candidates before preparing them for the personality that you should be ready with the perspective that you can be posted anywhere in India. Okay. So if you're getting into the railways, most of the southern zones they are already preoccupied. So you will be posted somewhere far. And even if you are posted in your neighbor, those are one days when you are posted in your home areas when there are ample of vacancies. And during your promotions, when you will be posted into senior administrative grades, especially in the railways, then you have to shift your divisions. From divisions, you may have to shift your zones. So you have to accept the railway as a complete, as a pan-India job. That is important. And similar, same things applies for the other cadres also. So it's very good that you are getting your home state. But if you're not getting your home state, then you should be prepared for that. So hope for best and ready for worst. That I would suggest, because Sagar is already posted in Northern Frontier Railway from the past 4 years. I am already from the Himachal Pradesh. I am now posted in Eastern Railway, Howrah Division. Already I am learning the Bengali. He is learning the Assamese. And maybe after some senior administrative grades, we will be posted into different divisions and zones. So you cannot expect. So definitely I will have a harsh words on this.
Yeah,
Over to
and
Sagar.
Rishi sir is the lucky one to be posted in Delhi. So Rishi sir is living in central Delhi at the very peak premium location of Delhi. So he has all the perks there. And the
Yeah,
best,
Sakshita want to ask something.
yeah, and best thing, marry somebody who's in government job in your hometown, and then you'll get all shipped there.
Good evening to all the respected panelists. My question is to Sagar sir. That sir, you told about the questions on surgery. So if we have seen certain procedure or surgery, but we are not very thorough with that, so should we just quote this that we don't remember or we are
No,
not thorough with that, or just we avoid that ki we haven't seen any surgery or that procedure?
no, just prepare one or two surgeries which are very basics, which you can just tell ki sir I have just assisted or I have just seen while others are doing, so that if they ask you some awareness questions like many of you have gonna tell I know ki I have seen sir lap cholecystectomy. The first question they're gonna ask you how many ports are there. So these are the basic things you have read in the books also. So try to prepare one or two basic surgeries about which you can answer very well. So that because they also don't know ki what surgery you have seen in a OT. You just have to tell anything. Like if you have don't seen the appendicectomy also, you can tell, sir, I have seen appendicectomy, because you can able to answer the questions of the appendicectomy. Like what type of incision we'll make, what type of suture we're going to use. They're going to ask you the basic questions which are more related to internship. They will more focus on the layers of the abdomen, the sutures you're going to use, is it observable, non-observable, what are the complications of the surgery. These are the things they're going to ask you. Like if you'll say, I have done dressing in the ward, so they're going to ask you related to dressing, like just I'll give you an example that when a diabetic patient came with a contaminated wound, how you going to dressing. So these are the things they're going to ask you, whatever you want to utter the word. So before uttering anything, just prepare yourself. You have so much time. Try to learn one and two surgeries from each surgical, like orthopedics, ophthalmology, ENT, everything. Just try to learn one or two surgery steps or anything you can, this basic things you're going to answer.
So that's
And
the reason
also,
in a
sir,
subject wise, yeah.
Yeah.
can I ask the question, Astha ma'am, or you want to complete?
Yes, please go ahead.
Okay, sir, I have asked this question before also, but like if somebody has a decent rank in NEET and if they ask that why are you preferring UPSC, so what all benefits can I quote? So I am just worried about that question the most.
You can say that, sir, even after doing PG, there is a saturation level, and again, I'll be looking for a job. So I want to secure myself a good, decent job, and this offers me the best possible gazetted officer tag. You can influence your answer like that. So among the various government options available in my state and central government, this happens to be the superior one. And also I'll be able to better assist in the national things. So if you are posted in a situation where you should tell that I am ready and I can move to any part of the country. So you say like that instead of saying that no, I would like to stay in my home state and all that, because see, they are picking those who are ready to go anywhere and serve any part of the country. So they will be preferring those people rather than people who are MCH or super specialized and they have certain thoughts to practice somewhere. So the government is looking for mostly for MBBS graduates. If you are a specialist, well and good. But they also want that they get a fresh graduate who is easy to mold, who can be easily taught the basics of the cadre. And the earlier you join, the higher you go. So you can say like that. If I can join PG after getting some what do you call permission from my higher authority. So that will be part of my service, and that will also add up to my promotions. So I don't want to lose on those perks. You can say like that.
And there's one question like how to prepare for ethical and situational judgment question.
So be neutral, be ethically neutral. So if someone asked about you that do you think that doctors practicing in the evening in private conditions, is it ethical? So you say no, sir, it's not ethical because it is going to hamper your existing service.
Also, sir, like I'm very much interested in surgery. Even my DAF points towards that I'm interested in surgery. So, like, and I have a rank in need that I will get a good surgery seat. So, if they ask, like, what will you do? Like, will you prefer that seat or will you go through UPSC for the seat? So, what should be my answer for
Very
that?
good, very good. This is one of the most common question you asked among the interviewees. So tell them that, sir, my preference will be UPSC first. And as now the authorities are very liberal in giving study leaves, in extraordinary leaves, they are very liberal. So I'll maybe get a chance after 2 years or 3 years, or maybe in-house. There is railway officers have in-house DNB options available. 50% of the seats are reserved for them. So that's also a very good option. So you can say your answer. Tell them that you really want this job. Don't say that you want to do surgery and then you don't want to join, because they are not preferring such candidates. They want candidates who need give their 100% to this cadre.
So, sir, my preferable answer should be that I would join UPSC and then, like,
Yes.
through that will go
Yes.
through PG.
You just enumerate the things, na, that, sir, the earliest I join, it will be beneficial for my length of service, for my promotions, for my perks and all. So the earlier I join, the higher up I'll go, rather than doing PG and then coming after 3 or 4 years and losing out on people, losing out on the seniority. So joining just after your MBBS is a better option for UPSC. PG everybody can do later on. Dr. Sagar has done after 2 years of his service. In-house, he did his general surgery.
Nishant
And
is
so the
now doing
leadership.
his Sakshita. I have to pass on the question to others, please.
Okay,
There
okay,
are
okay,
a
okay.
couple of other
Sure,
questions.
sure,
You
sure.
can have a one-on-one session or with Rishi sir, Nishant sir, anybody, right?
Okay,
Um,
thank you so much, ma'am.
yeah.
Welcome.
So there is this question. Can we have more on how to handle this ethical and situational judgment question? Because many, I think, are stuck or
See,
face challenges here.
coming this from Shahryar, I can imagine that he can be asked about the various questions. So in such scenarios, be a little towards the organization. Sir, you can just say that I will be working as my superiors will be telling me, as the railway government rules or the central government rules ask me to do. I will not be going against my government. I'll not be going against the organization rules, and I'll abide by the rules which have been asked by my higher authorities.
Fair.
So when you join a government job, you have a certain set of rules where you cannot join certain organizations, where you cannot openly, what do you call, promote certain things, because they come under the guidelines of rules and ethics. So whatever you can tell them that, sir, if government does not allow certain things, then obviously I'll also abide by the rules.
Perfect. Nishant sir, your point of view.
Definitely, Rishi sir has very well explained that whenever such questions will be asked, they may ignite you with the communal questions and all those questions. At the end, all the answers should be in favor of the government, because you will be the employee of the government, as they say, the servants of the government. So all the questions, whether it be the private, versus government, from this community to this community, for you, everyone will be equal in the eyes, and you will be with the government policies. That's it. And definitely, I don't want to extend it more.
Yeah, for perfect. So there is this. Is it necessary to work for at least 3 years in the service to get a study leave for PG?
See, different cadres have different rules. In railways, it has been relaxed to 2 years.
Okay, fair. So I think we are already up with that time. Sarthak, I have one question, that how to opt for one-on-one mentorship for the upcoming UPSC CMS interview.
That
Sar-
Asta will be telling you.
yeah, so Sarthak, it's a very simple process. I'll just walk you through for 1 minute. Sagar, I'm stop making you presenting. I'll present so that Sarthak and others will not get confused. You just have to go to Salaah Short's website, and यहाँ पे you will find that there's something called written CMS interview. So you just have to come to the CMS interview and book now. So you just have to book the session. So you can get two type of package. Either you can go for all the complete package, which consists of having your sessions on DAF to each subject wise session and then the mock interview. So it will have a consist of 8 sessions altogether. And if you are very much confident that your subject component is already covered and your DAF is already covered, you can directly be part of the mock interviews. So the another package will put you in a direct interview like state. There will be 4 panel members asking you questions from on the basis of personality or the subject related question. That will be in 45 minutes to 1 hour long sessions. So this will, here you will get 3 mock interviews. So whatever your preference is, go ahead and have it from here. So it's a very small process. Click here, book the one which you want, and you'll get a gist of all this thing. 3 mock interviews, 3 subject-wise session, and all the DAF and personality, each and every component, everything will be very personalized, because you are going to have one-on-one session with the Nishant, and everything is getting checked, that how you are entering, how you are sitting, how you are uttering a word, are you the one who is over explaining or under explaining. And when you'll have in a subject wise session, everything will be checked, that how you are explaining a concept or a topic, which is your strong topic or which is a weaker topic, and how to handle all that. And then Rishi sir and all those, there are more member in the panel, they can take your mock interviews, and they can then tell you that where to improve and where you are already doing good. So everything will be very personalized in this mock interviews. It's a very small UPSC prep thing we always have. It's a very small number of people we take and train them. So this year also we have taken very small number of people and giving them a lot of attention to get trained. Last year we took 6, and 4 of them have cleared the UPSC CMS. And the one he was talking about, the first session, the Sayak, we were like, there's no chance we are feeling that he'll be able to clear the interview. And he is one of them who cleared the interview. So there's a lot of component that takes care of it here, because if you're not comfortable or well versed with English, so there are so many people who are coming from southern part of India. They're already very good with communication, at least in communicating their thought in English. So how you have to stand out there, how you have to handle those, how you don't have to make language as a barrier and put your thoughts out. So there's a lot of ways to navigate the situation, and that is what in general is getting covered here. Any
Yes,
more?
someone has asked, can language barrier affects interview? No. If you want to answer your all answers in Hindi, you can ask panel members, sir, I want to answer in Hindi. So they're going to ask you questions in Hindi. It's not like that you just have to answer in English.
Yeah. Anything, anybody, or should we go ahead? Nishant?
Yeah, definitely. One thing I want to add on with Sagar, yeah, definitely you can speak in the language itself, but then you should be able to justify that thing in Hindi itself, that why you are answering in the Hindi. So probable questions will be number one, that your most of your medical books are in English. You must have given your vivas in English. Then why you are not comfortable in this? Number two, the thing will be that you are such a grown-up doctor. You have reached to this stage, and still you have not tried to learn the language. Let's suppose you are posted in some other state. So for example, I'm in this Bengal and Sagar is in Assam. So will you try to learn the new language or not? So all these questions you should be prepared why you are going with the English. So definitely, whenever you are posted in coming to this platform in the central services, then you should have that tendency to learn the language. Even if you are giving the answers in Hindi, just try to learn the English part. At least you should say something in English. We have that candidate that Asta already told. He was not well versed in the English, but for over the few weeks, he improved such a good person. So you should be ready with all these questions, and the answer should be in such a way that it should justify why you are speaking in Hindi or a one particular language. Okay, it should justify. It shouldn't look like that you have not given any efforts to learn the English. That is more important.
Very, very well said. Arvind, yes, please. Arvind, you have raised your hand. Please unmute and ask.
Am I audible?
Yes, you are.
Sir, I am comfortable in English now, but sometimes I might fumble. So can I switch to Hindi for that particular sentence or not?
Yes. For that you can do. So the whole gist is that you shouldn't sound that this person is complacent. He is not interested in learning. He doesn't have curiosity, and he shouldn't put he don't put efforts in learning anything. So that is what Nishant is all trying to put, that whichever situation, this is one of the life learning skills, that language is just one skill to learn. There are so many situations you are going to put into. Are you the person who will be like, mujhe nahi aata hai, I won't do it? I'm the person who takes things into my account and do my best to learn it. So on your question, Arvind, अगर आपको कोई answer देना है, you can combine English and Hindi all together. So some word you can play in English and some आप कुछ आप हिंदी में बोल देना. So the way I'm trying to put it here, कि आपका ये रह जाएगा कि this person is not putting out loudly that इसको English नहीं आती है, but he's trying, and trying counts. ठीक है, I think we will close this up now. Thank you all for joining in, and this video will be session over. This will be shared to you, all of you. I think in a day or two, the recording will be shared to all of you in a day or two, so you can watch it. If you need any help in the prep, feel free to ping us. We'll help you out. And
Ma'am, just one last question. Just one last question.
Yes,
About the leadership qualities that all of the people mentioned here, that, like, you know, Rishi sir, you said about that disaster like situation. So just some tips from you, like, and others also, like how to handle such questions.
I think we are short of time. So I just wanted to tell you that, see, as an officer, you have to do such roles. Instead of not only treating the patient, you have to take care of the disaster situation. If there is a train accident, and how you become the most important, the senior most person traveling in that particular train. If you're a doctor and you are with the railways and that train meets with an accident, so you have certain responsibilities. You cannot run away because your name is there. You are part of the ticket list and all. So then you become the senior most person, and you have to take care of the situation where you have to triage, and you can sort the patients as per the red, green, and yellow, and you have to take care of the people who need the attention the most, and those who are ambulatory, you can leave them. So these are the situations you can be asked about. If the time is running out, so you can ask.
Yeah, sure, sir. Thank you so much, sir, and to all the panelists.
Thank you so much, Rishi sir, Nishant, and Sagar, for coming in for the session. I know
Thank
it's a weekend. I know it's a holiday for sure, not weekend, but it's a holiday. And now Navratri is over, so many people are busy at their home cooking. So good food. So thank you so much for coming in and having this session. And all of you, you can go ahead and start putting efforts for the interview, because even if you don't want to join, it's one of a kind of opportunity all the doctors have got. So if you have cleared the paper, please go ahead and give it a very good attempt, because no opportunity should ever be wasted just like this. Okay, bye, good night.
Good night, everyone. All the best.